long-term disability carriers don't get about thoracic back pain, symptoms, and causes, and what you need to prove to get your ERISA disability benefits. Thoracic back pain and symptoms are something that disability insurance carriers and plans don't understand. So let's talk about a little anatomy first. The thoracic spine is the upper region of your spine around your chest area, and that's called the thorax. The thoracic back pain is characterized by upper back pain, and that upper back pain will radiate in a fashion where it comes around your ribs. In other words, it's coming around both sides of your rib cage. And you might have a numb feeling in your chest that's associated with a thoracic pain. I hear that complaint from my clients all the time who have thoracic back pain. So what are the causes? Well, disability carriers don't always appreciate not only the symptoms, but they don't necessarily appreciate the possible causes of thoracic back pain. And I think that it's crucial that your medical records and your history are documenting the causes of the thoracic back pain. Now, this can include osteoporosis, which will weaken the bones. It will also place extra stress on the thoracic region of the spine, and that's going to cause muscle and ligamentous pain. There also potentially could be an infection of your spine, and that can cause an abscess between the vertebral bodies of the thoracic spine. Again, it's going to be causing a lot of pain. You might have problems with an accident that has caused an injury to your ribs or to the bony structure of the thoracic spine. It's a vertebral fracture. You might also have spine surgery that has damaged the upper back. You might have a herniated disc in the thoracic spine. You might even have had a shingles infection that causes this neuropathic pain in the rib cage. Now, the disability carrier not only doesn't understand the cause, but once they kind of read a diagnosis, they want to understand what's the objective basis of the diagnosis that your physician has given you. So they're going to look for MRIs, CT scans, X-rays of not only the thoracic spine, but the rib cage area. Disability carriers also don't understand the treatment for thoracic back pain. Now, disability policies and plans will require that you get reasonable and appropriate medical treatment for your medical condition by a specialist. That's crucial because your family doctor isn't going to be considered to be competent or qualified. The carrier is going to be looking for treatment by an orthopedic spine surgeon, a neurosurgeon, a pain management specialist, maybe a physical medicine doctor. And if you have this neuropathic pain, tingling numbness, they're going to expect that you've also been seen by a neurologist who potentially will have performed what's called an EMG and nerve conduction study to document the level at which your spinal dysfunction is causing the thoracic pain. You should be complying with the medical treatment and recommendations of your physicians. Now, you can't be made to undergo invasive surgery, but the carrier is going to expect that you will have gotten physical therapy, pain medications, injections. As I've said, surgery can be recommended, but you're not required to undergo that surgery. You just have to document what treatment is being recommended by an appropriate specialist, and you need to be compliant with that treatment. Carriers also don't get the restrictions and limitations as a result of a thoracic back pain or back pain condition caused by an injury. Now, your doctor is going to be asked to fill out attending physician statement forms that are going to be asking your physician their opinion about your ability to sit, stand, walk, stoop, bend, lift. If your physician isn't going to cooperate, you've got to find a different doctor because you've got the burden of proof. Now, some physicians don't want to fill out these forms. They may say, go get a functional capacity evaluation that will help quantify your physical abilities. It's crucial, if that's the recommendation, that you get a recommendation from an ERISA disability attorney such as myself who can guide you to find a friendly functional capacity evaluator. Obviously, you should be consulting with an experienced ERISA disability attorney to make sure that your symptoms are well documented, that there is an objective basis for the diagnosis, that you are compliant with your medical treatment, and that your doctor has completed the appropriate residual functional capacity forms or attending physician forms, or that you go get an FCE that will document your claim. Call me today at 727-894-3188 if you have any questions about your rights to ERISA disability benefits for thoracic back pain.